medical vignettes focused on cardiology, hypertension, congestive heart failure, C arrhythmias, and ischemic heart disease. 1. Hypertension. A 52-year-old male presents for routine checkup, BP 150, 95 mmHg on 2 separate occasions. He has no comorbidities and does not smoke or drink. Labs are unremarkable. What's the first-line therapy? A. Lisinopril, B. Clonidine, C. Hydralazine, D. Minoxidil, A. Lisinopril. Explanation: ACE inhibitors are first-line in uncomplicated hypertension, especially in younger patients. 2. CHF. A 65-year-old male with reduced ejection fraction EF 35% and dyspnea on exertion is on furosemide. What drug improves mortality? A. Digoxin, B. Metoprolol succinate, C. Furosemide, D. Amlodipine. B. Metoprolol succinate. Evidence-based beta blockers, metoprolol succinate, carvedilol, bisoprolol, improve survival in HFrEF. 3. Arrhythmia. Atrial fibrillation. A 75-year-old woman with AF and HADS2 VASCI score of 4. What's the best next step? A. Start aspirin. B. Start apixaban. C. No treatment needed. D. Cardioversion. Explanation: anticoagulation is needed for stroke prevention in patients with CHADS2 VASCI POI2. 4. Ischemic heart disease. A 60-year-old man presents with exertional chest pain relieved by rest. ECG is normal. What's the next step? A. Stress test. B. Coronary angiography. C. Echocardiogram. D. Cardiac enzymes. Answer: A. Stress test. Explanation: for stable angina with no acute ECG changes, functional testing is indicated. Hypertensive emergency. BP is 220 mmHg with papilledema and confusion. What's the most appropriate management? A. Lower BP to 140/90 immediately. B. Use oral antihypertensives. C. Lower MAP by 25% within 1 hour. D. Administer nitroglycerin patch. Answer: C. Lower MAP by 25% within 1 hour. Explanation: in hypertensive emergency, rapid but controlled BP reduction is needed. 6. CHF, decompensation. A 70-year-old with CHF presents with weight gain, orthopnea, and leg swelling. What lab value best correlates with severity? A. BNP, B. Troponin, C. Creatinine, D. CKMB. Explanation: BNP is released in response to ventricular stretch and is useful for CHF evaluation. Snencher 7. Bradyarrhythmia. A 67-year-old woman with dizziness has sinus bradycardia at 38 BPM. Which drug can acutely manage this? Beta blocker, B. Atropine, C. Amiodarone, D. Digoxin. D. Explanation: atropine increases heart rate in bradyarrhythmia by blocking vagal tone. HEFS 8. A patient has chest pain with troponin elevation but no ST elevation. What is the best next step? Discharge with aspirin, B. Coronary CT, C. Start heparin and admit, D. Immediate thrombolysis. Start heparin and... Explanation: anestemia requires hospitalization and antithrombotic therapy. 9. Aortic stenosis. An 80-year-old presents with syncope and harsh systolic murmur at the right upper sternal border. Diagnosis: A. Mitral regurgitation, B. Aortic stenosis, C. Aortic regurgitation, D. Tricuspid stenosis. Answer: B. Aortic stenosis. Explanation: classic triad, angina, syncope, dyspnea. Murmur is crescendo-decrescendo systolic. At 10, ventricular tachycardia. A stable patient has wide complex tachycardia on ECG. Best initial treatment: A. Defibrillation, B. Adenosine, C. Amiodarone IV, D. Atropine. Answer: C. Amiodarone 4. Explanation: in stable VT, amiodarone is preferred. Unstable, defibrillation. 11. Pericarditis. Patient with recent viral illness has chest pain worse when lying flat, relieved by leaning forward. ECG shows diffuse ST elevation. Treatment: A. IV heparin, B. NSAIDs, C. Thrombolysis, D. Amiodarone. Explanation: viral pericarditis is treated with NSAIDs plus colchicine. 12. Hyperkalemia and ECG. A dialysis patient has peak T waves and widened QRS. First-line treatment: A. Calcium gluconate, B. Sodium bicarbonate, C. Furosemide, D. Kayexalate. Answer: A. Calcium gluconate. Explanation: calcium stabilizes cardiac membrane in hyperkalemia. 13. CHF with preserved EF, HFpEF. A 75-year-old woman has CHF symptoms, but EF is 60%. Next step: A. Beta blockers only, B. Diuretics for symptom relief, C. Digoxin, D. Implantable defibrillator. B. Diuretics for symptom relief. PEF has no mortality-reducing meds. Treat symptoms. 14. SVT. A young woman presents with palpitations, HR 180 BPM, narrow QRS. Vagal maneuvers fail. Next: A. Cardioversion. B. Amiodarone. C. Adenosine. D. Atropine. Adenosine is first line for stable supraventricular tachycardia. At 15, mitral regurgitation. Patient has holosystolic murmur at apex radiating to axilla. Most likely cause: A. Aortic stenosis. B. Tricuspid regurgitation. C. Mitral regurgitation. D. Mitral stenosis. C. Mitral regurgitation. Explanation: characteristic murmur of MR radiates to axilla. Would you like a PDF of these vignettes for offline review, or want another set in a different